I'm talking to Dave Sanders today. Dave is an absolutely fascinating guy who has been making just wonderful changes to some of the dancers that I work with. Dave is a pain specialist, pain recovery specialist. Got 25 years experience working with individuals and groups.
Please don't make me feel so old.
You're not as old as me, Dave. You'll never be as old as I am. But you've been working in clinics, gyms, professional sports teams, but also one of the things that interests me is that you work with West End dancers. You've worked with West End dancers in the past, and most recently with belly dancers.
Yeah, the newfound obsession of belly dancing, which has opened my eyes a little bit and has been fascinating to work with and really, really interesting. I genuinely mean that. I mean, all dance is quite interesting to work with because people forget they're athletes, and some of it is so intricate, coordinated, complicated, but not always treated in the same way athletes are. But belly dancers have been interesting so far.
Yeah. And it's been a fascinating journey for both of us, I think. I've been really fascinated talking to you over the last few months, and that's one of the reasons that I really wanted to get you on this live. We had a live a couple of months ago in my community, and the dancers there were just so interested in the stuff that you were talking about, because you specialize in pain recovery and rehabilitation. Is that right? And the way that you work is really sort of very holistic and very you bring in a lot of expertise from sort of slightly different disciplines. Is that right?
Yeah, no, that's correct. I mean, our main aim is to get people to move pain-free and enjoy the activity they want to do. And we look at everything from the biomechanics of the body, so the joint by joint. We look at what's going on with the brain and the sensory feedback it's getting, and it's how it's telling the body to move, and how the whole body moves as one. And we tend to work out, everyone is very different. Everyone gets some result from relieving pain, but we look at creating pain relief that lasts forever and prevents further injury. And that's where we've been really successful for a long time now.
Yeah. And you also help people to actually diagnose their own issues, to actually, find out exactly what the issue is, rather than sort of like just giving them a catch-all kind of like exercise or rehab program. Is that right?
Yeah, and we don't diagnose, because I have to be careful with that word. But what we do is we give people the ability to sort of screen and assess themselves and make sure their workouts or their exercises are very bespoke to them. So a lot of people follow very generic programs. You'll stretch both sides, you might strengthen both sides. Or we try and give people to start a program to get rid of their aches and pains, but then we'll get them into a little bit of self-assessment, self-care, so they can understand what exercises they need to do. Because especially with something as intricate as belly dancing, on top of, say, working days or other dancing or whatever it is, actually having the ability to realize your body will change week on week, day by day. Some of the same issues will still exist, but as I've found, especially with a couple of the belly dancers, the environment they're in before they go to the dance class or they lead a dance class can have a big impact on how different they are from day to day. So we give people that. Our main aim is to empower people to take control of everything themselves by educating them.
Brilliant. So tell me, obviously I know how we met and how you got into sort of, I say got into belly dancing. You don't actually belly dance yourself yet, but we may get you to. But tell me about the way that we met and the kind of like the journey that you and I have been on over the past couple of months.
Yeah, I mean, we met through a business mastermind and had some conversations, because you mentioned knee pain was coming up a lot. Which, as always, any pain fascinates me, because I like to look at the activity and think, well, why is it so prominent in that particular activity? And from that, we had further conversations. We did the first kind of live. Some interesting questions came up. We are very much, as you say, holistic, in that if someone tells us a symptom, we almost look everywhere else first to see what's going on. If it's a knee pain, we might look at shoulders, we might look at the brain. And it fascinated me, because with belly dancing, there's so much feedback. You've got sound going on, you've got eyes, the body's having to learn. And it's just looking at a very holistic approach to why someone has knee pain. So we started talking about that. And the first live we did, I was a little bit naive. I'd watched a lot of videos.
And I had kind of briefed you beforehand as well. I forgot to say that I sent you a video saying, okay then, Dave, these are the movements that we do. This is a shimmy, and this is how we do this, and this is how we do it. This is called a figure eight, and this is an upwards eight. And so I kind of like showed you all our core moves, didn't I? So that you could kind of get an understanding of the way that we moved before you actually started to sort of, yeah. I mean, and I remember you saying, now I understand why you've got knee pain.
Yeah. And we had a lot of look at the pelvis to start with and the shoulder girdle. And a lot of the dancers were talking about core stability, but the pelvic stability have been over, the pelvic function, the shoulder blades, the scapula have been overlooked. So all those very fine movements, which to me are like high-end athletic movements. They're similar to, someone doing the Olympics. Belly dancing is so quick, so reactive, and the body is very good at creating an illusion of doing it in a certain way. And the conversations we had, I mean, from that first live until now, is very, very different because I've worked with 10 of the belly dancers. We've got them away from pain. We've also found that they're getting feedback from their teachers, whether it's yourself or someone else, that they begin to move easier and things are happening. Because those movements are very intricate, but they're also very easy to kind of, as with a lot of sports, do with compensation.
Yes. So you sort of say that, I mean, I know you've talked about me, that I sort of like compensate my moves. If something isn't, it's a bit tight,
yeah,
I manage to kind of like blag it a bit and compensate. And
as all good athletes and sports people do, as all good performers do. And I think we started by talking about knee pain, and that was the prominent thing that had come up for you. And a lot of them were having treatment at the knees. And I actually, from what you told me, and then I started looking into it, and obviously now I know more, and I've watched so many things and spoke to so many belly dancers, is the movement at the hip. If there's hip dysfunction or there's issues at the foot and ankle joint, the knee pain's actually coming from there. It's not coming from the knee. The knee is not the issue with any of the dancers I've worked with. And it's the same with the back pain. A lot of it is coming from this kind of pelvic area, which is in constant movement, wherever lateral rotation, figures of eights, and there's so much movement up and down, pelvic tilts, anterior tilts. And that's the fascinating bit, because the pelvic function has become the start of our workshop in, is it symmetrical? I think that's the big thing that we found. Most people were quite asymmetrical in how they were trying to dance. So one side was very good. It might be mobile. The other side might be stiff, but it might be strong. And that's where all the aches and pains have been coming from that we've found so far, because that symmetry has never been looked at the actual hips and the pelvis. Hopefully that makes sense.
Yeah. Well, I guess it's not something that as a teacher, certainly I'm trying to make sure that my students are always dancing with symmetry. But of course, I'm also recognizing that I'm working with people who, we all have bodies that are sort of slightly different shapes, and I guess and also in belly dance there's a lot of self expression goes on, whereas in something like ballet, people have to be absolutely exact and accurate. We don't have that same. We have accuracy within our movements that as you discovered, we're very, very detailed in our movements, but there isn't the requirement for us all to dance exactly the same. So maybe that's where the sort of like, the symmetry thing isn't quite as pushed with us.
Yeah, when I talk about symmetry, I don't talk so much about the dance. I talk so much about like the biomechanics of the hips, for example, in that some people will do a movement, and as you've explained, I've seen now a lot of it is kind of telling a story with your body. That's what it is. And that kind of movement is the brain taking in information through your ears and turning it into movement. And that's been the bit that fascinates me. People can do it, and then we found, well, I've got constant knee pain or constant hip pain. And actually, it looks good, but the pain is the thing that's putting them off continuing and getting better and better and better. And we've kind of unlocked the hips, we've unlocked the pelvis, we've strengthened up certain muscles. We've done a lot of work with your dancers on what I call movement neurology, on how the brain engages movements, how it takes feedback, sensory feedback from the eyes, from proprioceptors, all the sensors around the body, and it sends that feedback up, and then it sends a feedback back down to switch on the right muscles, make sure muscles are being recruited efficiently. And that's been fascinating. That has been the absolute fascinating bit, in that there is, I won't say who it was, but there was one particular dancer could do everything, but there was one movement she was stuck with, where she was struggling. You couldn't see it visually, but there was a pain there. And we found that when we broke it down, the brain just wasn't, for some reason, recruiting the right muscles. And that was the thing that was putting her off dancing. And then suddenly it's gone. But a lot of it is just that kind of holistic approach, and also getting a great understanding from yourself and the other dancers that these are the movements we're trying to do. And I just look at it very much from biomechanical, quite boring, biomechanical sports scientist point of view, and go, well, if you're doing that, that muscle should engage, that should engage, that should engage, the brain should do that. And then you test these things and you find that certain things are out. And normally with most people, it's one or two things. It's not a major issue. It's just something is not right. And the problem is the impact is massive on the rest of the body.
And you work with different sort of movements than I've had in the past with physiotherapy. I mean, I think most people here, or a lot of people here, will know that I've had serious knee problems for a very, very long time. It started when I was 40 or so. I started to get knee pain, and then carried on teaching and dancing because that's my job. And, you know, actually sort of went through some quite major injuries, and then finally had two total knee replacements a couple of years ago. And so I've had a lot of physiotherapy in my time, as you can imagine. But I've just started working with you in the last few weeks, and the things that you've given me to do are quite different from the things that a physiotherapist would give me to do. And
I think to explain that with yourself, if I'd have seen you closer to when you had the operations, it would have been a big similarity. Because I used to work as part of a physio team. Physios would go to the area of issue, and then we'd take it from there. Because you're further down in the line, you've created a pattern of movement, and we're now trying to refine that pattern. So every program we give out is completely different. It depends on where the person is. If I'd have met you 2 or 3 months after your knees, I'm sure we'd have been working in a very similar way to a physio. But now we're at a stage where you've obviously been dancing, you're back dancing, you've danced a lot in lockdown from what you've said to me. So we're actually looking at those movements. So for you, it's been very much looking at the lines of muscle, and is the nervous system, you know, taking the information in, processing it, and sending it back down quick enough. Everyone is at a very different stage, and that's, you know, we're successful in what we do because we're trying to pick whether someone is at a kind of mechanical point, or what's as in there, do they need some structural alignment? Do they need to learn some sensory motor control, so get the brain switch on? Or is it that when the whole body moves as one, there's actually an issue in a line of muscle? Now, it sounds way more complicated than it is, because it's very simple. It's basically like the mechanics of the hardware, the kind of sensory motor control is the software, and the full body movement is kind of the nice, sexy paintwork. Okay, that's the way to look at it. And most of us actually can create the illusion of looking really good, which is fine unless you're getting pain. And we all know pain is the one thing. It stopped me playing rugby. It stopped many of my friends West End, in that they just slowly had to tailor their careers down. In my family, you know, my cousin and his wife were both West End dancers for 20 years. And the only thing that stopped them was they're in so much pain and had spent so much time just kind of masking over everything. And a lot of their friends were similar. And that's the complication of dance. Compared sometimes to sport, it's way more intricate and way more reactive sometimes.
It's interesting because certainly in all the years that I've been a teacher, I've so often had students come to me and say, "Oh, you know, I'm having problems with this knee, or with my it does tend to be knee, lower back, or ankle, there where somebody will get an injury, or they've got recurring pain, or just like in a continuous pain, and so they've been told, well, you know, you need to rest from your dance classes, or it's just something that niggles away at them, and you know, you can see them, they're just uncomfortable." And to be able to find some kind of solution is something that we all crave, because we all want to be dancing. We don't want to stop our dancing. And the last thing that we want, obviously, is to be in pain or discomfort when we're dancing from, as I say, you know, typically it's, well, I suppose it's, yeah, knees, and, you know, sometimes it's a little bit of shoulder as well. But the fascinating thing that I remember when I first started to talk to you is you were saying about, well, there's a couple of things really I want to say. One is, I'd love you to talk to people about why I remember you saying to me that what we do is just remarkable because of the way that we move and then stop the movements. Can you sort of explain a little bit about that?
Yeah, I mean, we'll just take the hips, because most of the knee pain we've dealt with came from the hips or the lower back. It had nothing to do with the knees. It just, because of the hip dysfunction, it meant the femur was out of line, the knee wasn't tracking correctly. So what I saw, which fascinated me, because I just saw lots and lots of movement at the hips that needed to be accelerated quickly and decelerated. And the body does two things. It accelerates a muscle and it decelerates it, or it contracts and it lengthens it. You know, but in reality, the speed you're doing a lot of movements, it's acceleration, deceleration. Okay. And what I was fascinated by was there were so many intricate movements, that a lot of speed around the hips, almost like, you know, an athlete throwing a javelin, but you're doing it huge amounts of times.
Yeah.
Okay. And what I was seeing was everyone's got quite mobile and they've done a lot of mobility work, but they've not learned how to control the slowing down to go to the next movement. So it's that, if you take it into other fields of activities, the ability to decelerate means you can accelerate quicker in the opposite direction. If you're running, the ability to decelerate means you tend to run faster. So a lot of Olympic success was built on deceleration, not acceleration. So with what you do as a dancer in any field of dancing, the ability to stop and start the movement is the key bit, because that's where the brain comes in, switches the muscles on to decelerate it before it goes in the other direction. Now, if you take that down to milliseconds and you're trying to move sideways or rotation or create a figure of 8, if there's any stops in that process, whether it's mechanical or neural, that's what I saw. That's like, okay, this is really intricate, but if someone has a tight piriformis, for example, so tight top of the glute, that movement is compensated somewhere.
Yeah.
If someone is trying to do that movement and a hip flexor isn't firing on one side and it's just rotating on one side, that's a problem. And all those little movements are what fascinate me. It fascinates me in everything. I'm the movement geek. That's life for me now. I just look at everything. People walking around superstores, people belly dancing, people riding horses. The movements, especially the more intricate the movement, the more complicated underneath it is, but also quite, in a strange way, the simpler it is, because it's just the ability for that muscle to switch on as that one lengthens. So one's shortening, one's lengthening, but in your particular activity in belly dancing, it's happening so quickly. And loads of the belly dancers I train now, they start to show me movements. That's made it more fascinating, because we start to break it down. We even had one of them teaching belly dancing in one of our classes the other day, but it made people realize how difficult it was.
Really?
You know, people think they can move, just went, well, why can't I do this? Because it's quite intricate.
This will be music to us. And Sandy Mayer has just said that she loves that explanation. Thank you very much. That's very helpful. It's fascinating, Sandy, isn't it? Listening to him, that's absolutely fascinating. But yes, I mean, we all belly dancers listening to this will be so thrilled that you say that it's not that easy, because of course we tend to live with people thinking that we just shake our bodies and, you know, anybody can do it. But we think that what we do is very kind of like very, very clever, very detailed, very trained, and we do train for years, and people don't really realize that. So it's great.
I think if you take it into any form of dance where you're expressing yourself through your body, whether it's ballet, you know, even pole dancing or belly dancing, I mean, the intricacies of it and the demand on the body is so unique. Okay. Yeah. And there's not a lot of strength and conditioning coaches or sports scientists out there who focus heavily. There's a lot of physios who work in that world, because you create a hell of a lot of pain, unfortunately. And the trouble is, you know, there's some very good physios, but a lot of physios are short of time, and a lot of physios will focus on the symptom. They don't look at the cause. You know, the workshop we've put together, you know, and it's been tweaked for the second one, is very, very precise to belly dancing now, in that it looks at the pelvic function of the 4 or 5 movements you would have to do. We look at them slowly. So if you can't do them slowly at speed, you've probably got no chance. And then we look at balance, and we look at, is this working? And that was the fascinating part of all of this so far, doing a little balance test and seeing that some people, one side were amazingly balanced, and on the other side really struggling. And with all the belly dancers we've worked with so far, I think the fascinating thing is that they all had hip pain on the same side. But I think we came up with an explanation for that, didn't we?
I think we did. I think we decided that you said that everybody seems to have pain on the left-hand side.
Yeah.
And my theory is that that's because we've developed very mobile pelvises. So because we need a lot of mobility in the pelvis. And that what happens if we're British, and I see that Jay is here, and Jay is French, and I'd be quite interested to know whether she's got pain on the right-hand side, actually. Because my theory is that we get into the car on the right-hand side of the car, and we go in and we clonk down on the left-hand side of our hips. Day in, day out, if we drive regularly, we clonk down on that side. And I think that maybe that's kind of shifting our pelvis. So, there we go. Jay has just said that she has problems on the right-hand side. I think our theory is correct. Jay is in France, so she drives on the other side of the road. So she gets into her car on the left. Jay, I think you have just solved.
I mean, it's a bit of throwaway. Yeah, it's a little bit of guesswork, but there are things. One of the things I do, we work really heavily in the equestrian world. We're doing quite a lot in the dance world, particularly with you, obviously. One of the things we look at is actually the environment away from the activity. And the environment away from the activity, whether it's driving, sitting at a desk, whatever it is, commuting, other forms of activity, is what's the impact on the hobby or the activity or the sport that's the most important to that person. Looking at the environment, because I spoke to belly dancers. How often do you dance in a week? And we have everything from 3 or 4 hours up to 2 to 4 hours a day. That's not the whole week. Okay, and that environmental bit is really important. And that's something, when we do all the assessments, we're looking at what we're really looking at is what is the body ready for when it goes into a belly dancing class. Okay, and if it's prepared well and the brain switched on, it will move as it's being told to, whether that's through auditory or a teacher, however it is. If it's not prepared and you walk into that class and you've got 2 days of sitting in a desk, a day of driving, or maybe you've gone out for an 8-mile walk or an 8-hour walk or something, that's where this is really important. This is where it prevents injury and decreases pain, but it also improves performance. Because the easier you can move, a teacher yourself will get much more much bigger results from someone who has prepared themselves to move. And by preparation, 5 to 10 minutes is so powerful a day to actually take away those environmental stresses. And everyone thinks of environmental stresses, but anything that locks the body up will stop you enjoying what you want to do.
This is probably a good moment, and we will go back to talking about some of the detail of belly dance, because there's something else that I know you say that always fascinates me, which is about all the sensory things that we're having to take in. But now is probably a good time to actually talk about the workshops that you've created for specifically for belly dancers. And if there's enough interest, then we'll keep doing them for as long as people want us to. And that's an live interactive workshop on Zoom, so people can join from anywhere. But can you just sort of explain briefly about what you do in that workshop?
Well, the main thing is interactive, so you don't have to sit and listen to me all the way through. What we do is we have identified the movements through me and my business partner that happens in belly dancing, that if those things aren't happening, they can cause joint pain at that joint or another part of the body. So in that workshop, we'll go through a little bit of the biomechanics of belly dancing, which is a title I never thought I'd be writing about, but it's actually a little blog I'm probably going to write in the next week, so it's really beginning to fascinate me. Once we've gone through that, we will focus to start with on pelvic function. We'll look at, is the body, does the pelvic, does the hip shift laterally? Does it rotate naturally? So we do some very simple tests you could do at home on your own. And then we look at little solutions to start correcting those things. We'll then go up the body, and we do all those together. People can throw in questions. We'll then go up the body. We'll look at shoulder stability, because if your posture's bad, mine's not great today, I've sat down a lot. If your posture's bad, you will struggle, to do anything around the shoulder girdle, and it will affect your lower back. But then we'll also do some balance tests. We have a bit of fun with that. I haven't done a workshop so far out of 20, 30 workshops in lockdown where we haven't had a laugh with the balance side of things, because we do some very different things, as you've said, where we test, is the brain taking feedback as you move to actually control the body. And we'll also then look at the foot and ankle mobility. The one thing we found with belly dancers already, Charlotte, is lots of mobility, not always necessarily the stability at joints that should be there. So we found quite a bit of hypermobility, which is either a genetic thing or it's kind of a force thing. But the workshop, that bit is all interactive, where we help you build a little bespoke program for you to start there. And then at the end, we do a big Q&A, and we tend to find the same issues have been coming out because the activity is similar. And then beyond that, we also give you a one-to-one complimentary consultation if you want to go a little bit further, because you'll quite often find the main thing we're trying to do is make you aware of things. And we normally have lots of light bulbs going off where people realise, well, I'm in pain, but I'm not passing the tests in the areas on that side.
Yeah.
And that's what the workshop is.
A program that they can take away as well. I remember when we did it last time, that in the workshop, so that people actually kind of test and find out what their particular issues are, and then you give them specific exercises that then they can go away and do to
our first step process is we'll test everything and give you, if you've got tight muscles which need stretching, but it's not always a stretching issue, or they're in spasm, we'll give you the solutions to unlock those muscles there and then on that day. If we find other things going on, that's where we look into a bit more detail in the one-to-one, which we do with everyone anyway. And the main thing is you to go away with the program. So what you might find is you might go away with something for your right hip, your left lower back, your right shoulder. It's very individual. And that's what a corrective exercise program, as I call it, should be. It shouldn't be stretch both calves 3 times, stretch both hips. It should be very, very bespoke to what that person needs. And our assessments are so simple, and lockdown has really made us refine this process, which is a positive. We've come up with the simplest things you can do on yourself. And as you know, Charlotte, some of them are so simple you think, well, I haven't had that done before.
Yeah.
They really give you a story very, very quickly, and you very quickly will go, well, actually, I am stiff on that side, or I do get pain in that shoulder from time to time. I'm not knocking core stability, but most people have tried Pilates or core stability. The trouble is, if your pelvis isn't in the right place, you don't always, or sometimes you can lock your pelvis into the wrong place by being very strong in your core.
Yeah. One of the things I mustn't forget to ask you about, going back to you saying how sort of detailed and complex what we do is, you were talking about all the different senses that we have to use when we're dancing, and with the music and everything. Could you explain a little bit about that?
Yeah, I can. I'll try and make it as simple as possible for myself, let alone anyone else. But I mean, we use our sensories to control our movement and control our stability and balance. So you use your vestibular system. So you use your inner ear. You use the tiny, funny hairs in your ears to control your balance. Most of us are very aware of that. We will use our eyes. We will use all the senses around our body, our feet in particular, obviously. And having that nervous system really switched on. So we're really getting the processing of information. So sensory information goes to the brain, and then the brain sending motor signals down to switch muscles on and do motor unit recruitment, which is switching the muscle fibers on, is really important. And the more intricate the activity, the more important it becomes. So we do a lot of stuff where if you look at belly dancing, most of it should be about taking the information in here and letting the body react. Now, what we've spoke about is a lot of people are using their eyes and their ears, and so we take away senses to make you focus on other senses, because in realistic terms, with what you do, you want to have good balance. So everything coming through here is just about interpreting the music into movement. The eyes shouldn't have to spend forever, looking at how you move. It should just be allowing you to, how's the way to put it? It's almost, I call it Jedi. It's almost Jedi. it's almost like you should be able to just move without feeling like it's conscious. So the more we heighten your nervous system, the more we look at improving your balance, improving the proprioception, which is the sensory feedback coming up the body. The more we take the eyes away from what they don't need to do, and the same with the ears, the more it feels subconscious. And that's one thing I've mentioned. A lot of what we do is try and take people away from conscious movement to subconscious movement. The best athletes, the best dancers, everyone calls it in the zone. What's really happening is their nervous system is completely in tune with their mechanics, and there's very little issues going on in either. So suddenly you can move, and anyone can achieve that to their level of fitness or their level of health. But it's just having the right drills. As you've seen, and you are right, a lot of what we do, is very up-to-date research, very up-to-date science, looking at adding in neurological drills alongside mechanical drills, and then with some more normal exercise.
Yeah.
But the sensory thing is massive. The sensory thing is massive. If you're trying to listen for something, but your ears are having to get involved in everything else, and your eyes are having to get involved because you're proprioceptive, the sensory system isn't really helping you balance. I think we talked about it, and one of the belly dancers agreed with me. When she's struggling with pain, she struggles to follow the music as well, because the brain is having to process too much information.
Yeah. Yes. I can imagine that. The other thing that I notice as a teacher is that a lot of dancers, when they're practicing performance, will look down. They're actually looking at their body. They find it very difficult to look straight ahead. And I guess that's sort of like underlining what you're saying, that they need their eyes to just kind of like be checking what the body's doing, and to actually be just looking up and just trusting that your body is doing the things that you want it to do. It's quite something.
Yeah, and the sensory, when people ask what we do, we're actually brain and body movement specialists, because we're trying to link the two. So everything is linked. You take out the software, the hardware doesn't work. So the more we can heighten the nervous system, the more we tend to get from also working through exercises. I mean, anyone who's suffering chronic pain or recurring injuries in the belly dancing community, please come to the workshop, because we will look at it very holistically. We will look at very simple solutions for you. We're not there to give out massive exercise programs. We're to give you very short, results-driven programs. You normally find, because you're already active and you can move, it's very simple things that need resolving.
So Jay here saying she has reflex sympathetic dystrophy. I haven't heard of that. Have you heard of that one, Dave?
I have heard, but I'm not going to go into detail because, I mean, please PM me, that person, and I'll answer the questions if there's other questions around it, because it's something I'm aware of, and it's something I work with someone on quite a lot. Yeah.
So Jay, I will introduce you to Dave so that you can send him a DM. So I think you're probably not already. So if I sort of like introduce the two of you, then you.
Please do, because there's neurological drills or exercises that we use definitely can help with that with what I understand. So I'm not going to sit here and I want to look at something first.
One of my other dancers, Carla, was saying that she has problem with runner's knee, with patella. And you were saying that was something that I can't remember what you said about that actually.
Was that with the softening of the cartilage?
Sorry to interrupt. She said that causes her a lot of pain when she shimmies, particularly. She finds shimmying very painful.
Yeah, so the person we're talking about has condition which basically the cartilage is not as rigid as it should be. So you tend to find that the knee will laterally shift one way or the other. Now, when you shimmy, if there's not enough stability at the hips to control what's happening below the hips, and there's not the traditional way would be to strengthen up the inner quads. So you'd strengthen on the inside of the thigh muscles to try and keep that knee tracking, which is fine. But if there's issues at the hips or there's issues at the foot and ankle, you will still find the problem being caused. So if someone's moving from side to side or rotating or whatever's happening at the hip, you will find, or even at the shoulders, you will find that the knee is just not being stabilized enough from the hip downwards. Does that make sense?
That does make total sense, because that's exactly the problem I had, was with tracking problems. Yes, that's exactly the problem I had.
You'll find the knee, you might find the hips are actually mobile enough, but they're not stable enough, or the other way around. You might find one hip's mobile, one stable. So by that, I mean the pelvis might tilt back or tilt forward. And the impact might be like the femur internally rotates, so the kneecap wants to pop out. I mean, that's just surmising without doing the test, but there's so many things that are going on at the knee if the hip isn't reacting as it should do, along with also strengthening up certain things around the knee. And again, with anything with patellofemoral syndrome, basically, if the balance is out, the knee comes under pressure. So again, the nervous system comes into it.
Right. So I guess we had better wrap up. If there's any other quick questions or anything else that you'd like to mention, Dave, is there anything else that you'd like to say before we?
No, just if anyone, I mean, I found it really fascinating, really genuinely fascinating. And you know my passion for this and for any movement. in just that intricacy, and the injuries that are occurring around the lower back and the knee are quite easy to resolve as long as you know how to deal with it. And that's what we'll do in the workshop. We're there to just take you through, have a bit of fun, which is important, but also just get you to understand your own body a little bit better from a mechanical point of view and a neurological point of view, and the carryover into every activity we get involved in. There's 30 years experience in our business, plus hundreds of years of partners experience, is we can help you get away from pain so you enjoy what you do. That's what's important to us.
That's brilliant. That's absolutely brilliant. Thanks so much for your time, Dave. It's been a really fascinating journey for me. I mean, I've really enjoyed the conversations that we've had and all the things that I've learned from you. I mean, you're an absolute wealth of information. I'll never just let everybody know, one of the first things I sent Dave was a drum solo, and he was like, oh my goodness, how'd you do all that?
Yeah, I do remember that, and I've still got that logged when I look at through things. But I mean, that is the point why this actually fascinated me, because when I looked at the first couple of things you sent me, I just saw movement at almost ridiculous speeds, and then thinking, well, people must train for years for this, and yet people don't want to, I can't find much information out there talking to me about the conditioning side of it, let alone, there's a lot out there on rehab, but there's a lot that could be done from a sports performance point of view, activity performance point of view.
Well, I don't think there has been really any specialised work, as far as I'm aware, looking at what belly dancers should do to condition their bodies in preparation for belly dance. And I think that's, sort of a historical thing as much as anything else, because it comes out of a sort of a dance that traditionally, sort of young girls learn at their mother's knee. I mean, it's a so, it comes out of a sort of like a social dance, really, if you like. Yeah. And it's only in sort of recent years that it's become more sort of more and more athletic and more and more professionalized, if you like. And I think, yes, we do need to look at how we can make sure that dancers are well conditioned and well prepared for their classes. And as Stephanie has just mentioned as well, many of us come to belly dance late in life. That's very true, Stephanie.
Yep.
It's not something that we traditionally learn. No, no. In ballet, you start learning ballet when you're 3 or 5. I started learning when I was 5. But in belly dance, traditionally, we come to it much later in life. So already got our sort of various injuries and, well, not injuries, but little sort of stiffnesses and
compensations.
Yeah, absolutely, absolutely.
But hopefully we'll see lots of people at the workshop, because I am finding this so fascinating, and I'm sure it'll be different with every person, as it has been so far.
Absolutely. Well, I really, really value your time, and I really appreciate the time and enthusiasm that you've put into this, Dave. It really has been great for somebody to have taken what we do seriously and to have been honestly fascinated by it, and the research that you've done has been absolutely wonderful. And
it's been made easy. It's been made easy because the passion from the 10 dancers I'm working with has been massive as well, and they're all at very different levels. So their passion for what you do has been huge, and they've been helping me as much as anything, because every time I say, well, what do you do? I've had a big, intricate, detailed response, which makes my life a lot easier.
Thanks so much, Dave. I really, really appreciate it, and I look forward to seeing you soon.
Take care. Thank you very much.
And you too. Thanks a lot. Bye.